Hello, my name is Rachel Chait, and I'm from University of Miami Miller School of Medicine. I will be presenting my poster on addressing the U.S. physician shortage, a legal epidemiology analysis of nurse practitioner scope of practice laws and the impact on primary care access. Nurse practitioners, also referred to in this presentation as NPs, are often used in practice in areas with physician shortages, underserved areas, or to help physicians care for an extensive volume of patients. However, each state has their own laws defining the different levels of independence that an NP can have. Currently, the scope of practice, there are three levels: full, reduced, or restricted. You can see on the left side of this poster of a map of the United States with each of the different levels of scope of practice. Currently, there are 28 states that operate at a full scope of practice level, 12 states that operate at a reduced scope of practice, and 11 states that are at a restricted scope of practice. Full scope of practice means that NPs can manage all aspects of the patient care, from diagnosis to initiating treatment and being able to prescribe medications and controlled substances. Reduced means that NPs are only allowed to do or not do one of the things I just mentioned, and restricted scope of practice means that NPs are very restricted in what they can do and need to be supervised by a physician. Additionally, it's important to note that NPs are a cheaper source of labor compared to physicians, and 88% of them are already currently working in primary care. They could be a really good source of labor to use with the physician shortage that's predicted to upcome in the next decade or so. The methods for this project was to use legal epidemiology across 6 U.S. states: Oregon, Washington, California, Texas, Florida, and Illinois, to represent a variety of regulatory frameworks. To do this analysis, we looked at each state's laws and coded them in order to understand what the laws meant. Then we looked at each health outcomes by state to understand how these laws affected health outcomes. So you can see in Table 1, we outlined scope of practice laws by state. So California, Texas, and Florida are three of the restricted scope of practice states we'll be analyzing. Illinois has a reduced scope of practice, and Oregon and Washington have full scope of practice. It's interesting to note that California and Florida, which are currently restricted scope of practices, both either have updates to the law or rules that can let a nurse practitioner have full scope of practice if they either work 3,000 hours under a physician or there's a new bill in place. Table 2 outlines right here all of the health outcomes by state. So you can see that California, Texas, and Florida are the restricted scope of practices. However, they have the most number of nurse practitioners, the least number of PCP ratio to population, and the least number of family medicine wait time days. It's also important to note that Oregon and Washington, which have currently the full scope of practice, have the least number of nurse practitioners and the highest number of PCP ratio to population. However, they also have the longest wait time days with about 24 to 44 days. It's also interesting to note that if you look in this age-adjusted death rate column here, there's really no correlation between the scope of practice of the NPs, the number of the NPs, to any of these age-adjusted death rates. So ultimately, we can see here that nurse practitioners may help with our PCP ratio to population and may help providing care for increasing primary care access. However, they're not really going to help reducing any morbidity or mortality. Some limitations to the study include the fact that both of the full scope of practice states, Oregon and Washington, do have smaller population sizes compared to the rest of the states, which can confound some of the health outcomes. Also, most of the full scope of practice states have smaller populations, except for New York. So ultimately, changing scope of practice laws for nurse practitioners can help increase access to primary care and improve the PCP ratio to population, but may not necessarily improve mortality. It could be also difficult to regulate and monitor scope of practices and of NPs in states with larger populations, since there are a lot more autonomy in ways that healthcare workers are practicing. Additionally, nurse practitioners can play an important role to help combat the physician shortage. Thus, I suggest that future research should be done to explore other health outcomes such as quality of life and analyze death rates by causes in relation to nurse practitioner scope of practice. Thank you for listening.